Hello, I'm Ben Kantz, and I will be talking about understanding and addressing homelessness through dignity. Homelessness is one of the most documented and talked about aspects of poverty and inequality. However, it is also one of the most misunderstood. In the United States, the way homelessness is addressed and understood only works to exacerbate the harmful effects on the individuals experiencing it as well as society at large. One study that followed 37 homeless individuals over 10 years discovered that the cost of anti homeless enforcement to taxpayers exceeded $6 million. The immense cost of taxpayers is one of the many missteps that come as a result of not understanding the causes of homelessness and the methods used to address it. The belief held by many people in the United States is that homelessness experienced by able bodied individuals is a choice, their lack of financial success as a result of their motivation and character. Although in some cases this might be part of the issue, the social and political structure they live in works to systematically to prevent advancement through social stigma, disability, structural barriers, and numerous health implications. As a result, policy addressing homelessness revolves around punishment of their condition rather than the systems that keep them there and brought them there in the first place. One major thing that people don't understand about homelessness is the range of health, educational, and social deficits that people growing up in it undergo. Individuals raised in homelessness experience the effects even before they are born. The lack of proper nutrition and quality prenatal care has been shown to have significant effects on both physical and mental abilities of the infant. The instant deficiency only carries on through childhood, so they're more likely to experience infections, stunted growth, and are more than twice as likely to be hospitalized when compared to the average child. These health issues are both financially and physically taxing to families, adding to the additional stressors of the plate, which prevents progression. Another major developmental concern with homelessness is the increased potential of an adverse childhood experience, or ACE. ACEs are associated with a plethora of negative social implications, including behavioral deficiencies, chronic mental health disorders, and developmental delays. A study found that while only 3 to 5% of the population experienced 4 or more ACEs, when looking at the homeless population, that number rose to 53%. The combination of these issues results in a decrease in health and employability, as well as an increase in crime and incarceration. Improper prenatal development, childhood nutrition, and exposure to ACEs all contribute to reduction in education, where a homeless child is more than twice as likely to drop out of school. Additionally, dropping out of high school more than quadruples the likelihood of experiencing adult homelessness. When all of these factors are taken into consideration, the cyclicality of homelessness becomes clear. There's a pervasive argument in American culture that able-bodied homeless populations should just get a job, and that the money of hardworking Americans should not be taken to enable their laziness. This is, however, much easier said than done, considering the hurdles that a homeless person would have to overcome to acquire and maintain a job to gain residence. The first hurdle to acquiring a job is the expectation of presentability and the social stigma against the homeless. When one is interviewing for a job, it is expected that they look presentable and seem put together. Although many nonprofits help the homeless with this very thing, the social stigma that the homeless are dangerous and unreliable persists, which keeps the homeless from employment, even when they are seeking it. Employment also requires identification like social security number, birth certificate, and an address, all of which homeless people commonly lack. Another issue with employment for the homeless is their ability to maintain it due to the culture of drugs and violence that surrounds them. The culture they live in and were raised in is not conducive to a working environment and is often difficult to maintain a job and extremely difficult to escape while still experiencing homelessness. Finally, as housing costs rise faster than inflation, especially in big cities containing the majority of the homeless, and increases in minimum wage don't come close to matching, it becomes more and more difficult to acquire housing. These hurdles make it increasingly difficult to acquire and maintain employment that provide for housing and their basic needs. Although homelessness can happen to anybody, it disproportionately affects the disabled population, especially those with an intellectual disability disorder or IDD. Around 50% of people experiencing homelessness have some form of disability, with IDD occurring in 12 to 39% of cases. This results from a lack of societal understanding and sufficient policy to support individuals with disabilities. IDD is often stigmatized due to the wide-ranging severity and uniqueness of individuals with IDD. Because it exists on a spectrum, those who don't show any obvious or verbal or visual cues are not recognized as having IDD. IDD is frequently mistaken for someone being rude, aggressive, or delinquent as a result of the communication barrier and lack of social comprehension. This creates ostracization towards those with IDD, which leaves them vulnerable to financial exploitation, theft, and human trafficking, all of which contribute to homelessness. Another contributing factor is the one size fits all Social Security income, or SSI, benefit policy in the United States, which presents difficulties for qualification and is ineffective at supporting those with an IDD without guardians. For people with an IDD over 22 to qualify for the SSI benefit, they must be able to prove presence of a disability during childhood. This presents significant challenges for the homeless individuals without conclusive records and documentation. Even if someone with an IDD can qualify for Social Security income benefits, the $841 monthly payment is not nearly enough to provide for a person with IDD to live off of. The lack of policy and understanding leads to individuals experiencing homelessness with an IDD, leading to a system churn where they cycle endlessly between the streets, shelters, hospitals, and jails. The final misunderstanding is the financial cost of homelessness. Many Americans are against their tax dollars going towards combating homelessness. However, they don't understand is how much of their money is going to the enforcement and incarceration of the homeless, making homeless lives worse when the funding could be used more efficiently to improve their lives and get them back on their feet. Current approaches prioritize temporary fixes that act as financial drains rather than sustainable solutions. For instance, the criminalization of homeless through ordinances banning camping or loitering versus reliance on law enforcement and emergency medical services. Research highlights that these punitive measures do not reduce homelessness but merely shift its visibility while incurring massive public expense. For example, Boulder, Colorado spends at least $1.8 million annually simply enforcing anti homeless ordinances, while the Los Angeles Police Department allocated up to $87 million in a single year solely for interactions with the unhoused, excluding standard patrol costs. These expenditures create a revolving door between the streets and the criminal justice system, where the cost of arresting, booking, and incarcerating individuals far outstrip the cost of housing them. Beyond law enforcement, the reliance on temporary emergency measures is fiscally irresponsible compared to long term solutions. Non-profit providers spend over $56,000 annually to provide temporary shelter for a family, more than double the $25,390 requirement to fund a permanent supportive housing unit for the same family. Furthermore, the lack of stable housing forces individuals to rely on costly emergency medical services. Almost individuals visit emergency departments 3 times more frequently than the general population. Data from Los Angeles County demonstrates that placing high-need individuals into permanent supportive housing reduced their average annual service costs across health, corrections, and general relief from over $38,000 to approximately $15,000 per person. When taxpayers support criminalization over housing, they're effectively choosing um, to pay a premium for a system that perpetuates instability rather than supporting a policy that helps the homeless. So, what policies should be in place to support homeless people while also respecting their dignity? Research demonstrates that rather than putting them in a house or controlling their spending, we should trust homeless people by providing them with financial support to escape homelessness. The Denver Basic Income Project, or DBIP, a study that involved an unconditional cash transfer to homeless people in different amounts and intervals to track their progress, highlights how respecting their dignity by effectively providing them with a stipend was effective at combating homelessness. The results of the DBIP challenge the paternalistic assumption that individuals experiencing homelessness require strict oversight to manage their resources. By designing a program around low barrier access and unconditional use, the project allowed participants the flexibility to address their specific needs without mandated financial literacy classes or sobriety requirements. The data overwhelmingly validates this trust based approach. The study involved randomization into 3 groups recruited from shelters and community organizations. Groups are randomly assigned, but the DBIP may not provide a completely representative sample of the homeless population, given that those not associated with any aid organization are likely worse off, which opens the door for more widespread research in the future. In the study, Groups A and B received $12,000 a year. Group A received $1,000 a month, while Group B got an additional advancement of $6,500 and then $500 a month. Group C only receives $600 throughout the year in $50 monthly installments. Interestingly, across all payment groups, the percentage of participants reporting they lived in their own house or apartment rose dramatically between 6 to 12%, and enrollment to approximately 45% after 10 months. Even though Group C received only a fraction of the assistance in Groups A and B, they saw significant, although not as pronounced, increased feelings of safety and ownership of a house or apartment. This demonstrates the power that even a small increase in autonomy has on these individuals and sets up interesting future research into the effects of trust and independence rather than mediated spending. Furthermore, the proportion of participants who considered themselves as stably housed more than doubled, jumping from 20 to 50%. This shift indicates that when financial barriers are removed, individuals possess the agency and competence to secure safe environments for themselves. Critics often argue that cash transfers will be spent on drugs and alcohol, yet the DBIP spending data refutes this narrative. Analysis of debit card transactions revealed that the majority of funds were utilized for essential survival needs, with the highest categories being manual cash disbursements, retail stores, and utility services. However, it is difficult to get the full scope of their spending, given that it's not possible to check their cash spending that was freed up as a result of the additional income. Even if they did end up spending more money on illicit substance, the study demonstrates that the financial autonomy directly translated to an improved economic stability. For those receiving larger incomes, groups A and B, the ability to pay all bills doubled over the study period. A possible limitation of this data may be a result of overpronounced success due to the possibility of a significantly worse outcomes for the 30+% of individuals who withdrew from the study. Moreover, this approach proves to be economically efficient for the community by empowering individuals to stabilize their lives. The system saw a reduction in public service interactions such as emergency room visits and jail stays, resulting in a total estimated savings of $589,214 for the participants analyzed. Ultimately, the DBIP illustrates that policies rooted in dignity and financial trust not only improve individuals' lives, but also alleviate the systematic burden of homelessness. Addressing the crisis of homelessness requires the dismantling of the pervasive social myths, characterizing it as a personal failure and laziness rather than a result of systematic structural barriers and health deficits. As the data reveals, the current punitive approach is not only morally unacceptable, but also fiscally irresponsible, costing taxpayers millions while failing to address the root cause of the instability. Evidence from programs like DBIP proves that replacing stigmatization with trust-based financial support effectively empowers individuals to secure housing and regain their independence. Truly solving homelessness demands a shift in policy that values human dignity over criminalization, recognizing that sustainable solutions benefit both the unhoused population and society as a whole.